Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and I had a question come in yesterday from a doctor who was going to be bonding some buttons on for Invisalign, and they had some questions about how much adhesive to put on the back of the button, and it's a fantastic question. And the other question they had was about positioning of the button with the aligner, and I don't necessarily have the best demo for that. I'll look around and see what I have, but I think it's pretty self-explanatory. So let me go ahead and show you real quick what we have and how to do it. So first of all, let's talk about bonding buttons. You can see here that, oops, I don't know if this is blurry or not. Let's see. I'm trying to get it. Okay, so for example, there's a precision cut or a button cutout right here. Can you see that? It's like a little half moon shape cutout. All you're gonna do is put your attachment template on, or if you're doing your buttons not at delivery at the same time as attachments, using my voice, whenever you're starting the buttons, whenever this half moon comes, you're gonna slap it on, make sure it's seated fully with chewies. If it's not fully seated, you cannot do it, okay? Because it's not gonna go on right. And then all you're gonna do is center that button on the tooth, not right at the gum, not right at the top, but right in the middle. So you should have at least a millimeter all the way around, because if somehow it wasn't fully seated, you'd be knocking it off. If you put it down by the gum line, it would be kind of moist and it wouldn't stick good, right? And if you just use your normal isolation to do this, I mean, whatever system you want. Personally, my personal preference is, no, don't use flowable. Do not use flowable. That's not gonna work. Use bracket cement. And there's a zillion different types of bracket cement. This is actually not my favorite, but this is just a bracket cement, which should be fine. But the one I like is called Transbond. Also, anything by Reliance is great. So Transbond is by 3M Unitech. Reliance is great. Their stuff is really, really good. They're like top of the line for adhesive and bonding to teeth. But for demonstration purposes, this should be fine. But just the normal stuff, you're gonna use your etch, right? Your blue etch, unless you have a porcelain crown, and hopefully if you had a porcelain crown, you did not put a button on that tooth. You hopefully planned in advance and requested not one. But for standard teeth, blue etch, right? Etch for 15-20 seconds, rinse, change the cotton rolls, air dry till chalky. So the tooth is chalky, keep it isolated, don't let it get unchalky. Then put on your primer. Some primers are AB, some primers is just one step. You're gonna scrub, read your directions, because you're most likely gonna have to scrub your primer in. Sometimes you have to air thin, sometimes you have to light cure, so you need to read your directions. They're all different. Sometimes you have to mix. Wouldn't recommend going to the lollipop one-step whole process until you get the things down, because there's a lot of errors that can happen in that process and you're not gonna know, right? You should definitely watch my video on bracket breakage too, because if you're having breakage, there's probably an error in your step, right? So etch, rinse, dry, chalky, prime, however the prime thing is. And then go ahead and get your bracket and get ready. So it doesn't matter if you're using a bracket. You can even use a bracket, but sometimes it doesn't fit very well with the half moon shape, right? But whatever works. Depends on how big the tooth is. Or you can use a button. This is actually an eyelet, but for demonstration purposes, it'll work just fine. I'll show you how much glue to put on, if I can open this. Oh goodness, okay. I should have pre-opened this before we started. Oh goodness. Okay, we're gonna do the bracket. Okay, hang on. So I'm gonna go ahead and get it out. I'm gonna show you how much glue to put on. These are some big brackets. Okay, these probably would actually not work for the half moon shape, but at least you can see how much glue to put on a bracket. Okay, so whenever you use bracket cement, of course you wanna get a bracket holder. It's better than a hemostat, because when you use a hemostat, you have to click it and then it kind of shakes it. So I'd rather use a bracket holder. Whenever you get the glue, you want to get your pad or whatever and dispense a little bit out first, because the top part sometimes is dry and that's not going to stick good. There we go. So I smear a little bit out first until it's sticky. Yep, it's sticky, so you're good. Okay, so all you're going to do, and again, don't use flowable, okay? So all you're going to do is just smear a little bit on the back of here, and I'm kind of looking, sorry. I'm doing this in like a weird angle, so sorry if my hand's shaking, but I'm doing it through the lens. Is that enough? I can't even see. There's no light here. And yeah, remember, you can't do it, and that's decent. That's actually too much. Okay, remember also, you can't touch the back of your bracket, because if you get the oils on it, it's not gonna stick. So if you think you touched it with your fingers, it's better to get a little rubbing alcohol and wipe it off, okay? That's probably a little more than I need, but you know, better more than less, because when you push it down, so I'm gonna act like this is on the tooth right now. Actually, I can bond it to a tooth. Let me find something to bond to. I always have stuff to bond to. Okay, let's bond to this. This is a model. Oh goodness, there's like, the molars all have stuff. Not a good one. Okay, fine, same thing. So let's say, for example, this was a button, okay, but it's not, and we were gonna bond. You would just press it down, okay? Make sure you get it in the right position. But I mean, if you have a template on, it's gonna basically show you what the position is. Like I said, don't be at the plastic, don't be at the gum line, okay? And just press it down, and whatever flash there is, you know, you can use a scaler and just wipe it away and light cure. Now, if you're doing indirect bonding, different story. It's actually tipped, but because you really can't do the flash. So you just have to get your right amount of glue, you know, just a smear on the back of it and then press it down. So yeah, that's pretty much it. Hopefully that was helpful. Hopefully you enjoyed this demo. Thanks so much.